Welcome back. With students returning from winter break, the University of Texas Clinic is seeing a rush of activity. So far this season, it's administered 10,000 vaccinations. The university usually offers shots in September and October, but they've decided to add an extra flu clinic in January and February because of the increased flu activity nationwide. This is the busiest the UT Clinic has been since the H1N1 scare back in 2009. And joining us now is Dr. Ann Buchanan. She's the Medical Director of Emergency Services at St. David's Medical Center in Austin. Thank you so much for being here today.
Thank you, Brian.
We've heard a lot of stories, obviously, about this flu season, some sobering stories. But can you talk about what you've seen in the ER this flu season?
Well, certainly we've seen a surge of flu this year. Last year we hardly had any flu, so this year has been a great blossoming. And we're seeing a lot of sick people, very sick people, elderly people that are getting very sick with the flu and having resultant pneumonias, requiring to be hospitalized. We're just seeing a mass rush of just generally ill people that are coming in that haven't had their flu vaccines, that are getting the flu. And you feel awful when you have the flu, so they're coming to the emergency room because if they haven't had the flu before, they don't understand how bad they're going to feel.
Sure, and we have heard that this vaccination is a pretty good match for the flu strand this year. How would you compare it to years past?
I think it's been a great match. I certainly could say that our doctors who have been immunized have not gotten sick. We have not seen a great deal of people who have had the vaccination that have gotten the flu. There are occasional cases, and generally those cases, if they get the flu, the symptoms are milder after they've gotten the vaccine anyway.
What happens to the ER when you have an influx of flu patients?
So when we have an influx of flu patients, we have a surge and we have an overflow of people where we're trying to admit people and we don't have beds in the hospital, and we end up with admit patients in the ER. The hospitals around town are full and overflowing, and the more and more people that come with the flu, that increases that ER overcrowding.
And what's the major difference, would you say, in the care that you get for flu patients at an ER compared to an urgent care or a doctor's office?
Well, you know, if you're very ill, if you can't breathe, if you're elderly, you're so weak you can't get out of bed, certainly I think that's appropriate to come to the emergency room. If you're just achy and feverish and but you're still walkie-talkie, normal functioning, healthy human being, I think you can go to the urgent care or to your regular doctor's office, get Tylenol, get Motrin, drink fluids, and stay in bed and rest. Doctor's note to stay home from work.
In addition to getting the vaccine, any recommendations to try and avoid the flu symptoms?
Again, if you're sick, stay home. Don't spread the flu to your other coworkers, classmates. Wash your hands frequently. Don't drink after people. Cover your mouth when you cough and use the crook of your arm, not your hands that you're going to use to shake somebody else's hand afterwards. That's the biggest things. And
the complications, obviously, that arise from that influx of flu patients, you would like to stay away from as an ER director.
Yes, we don't, we want to be able to serve our patients, all of our patients, but certainly we want to be able to serve the patients that are having to be admitted and the patients that are there that need the emergency room. So if you don't need the emergency room and have the ability to go to your primary care doctor, I think that's appropriate.
Thank you very much for your time, Dr. Ann Buchanan. She's the Medical Director of the Emergency Services Center at St. David's.
Thank you.
Thank you.